What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted.
Hi everyone, Dr. Steve Rasner here. Welcome to the Lionhearted. Hey, a lot of firsts today. It's 8 o'clock in the morning and I've never done a podcast this early. Not that it's early, but it's my day off. If I don't do it today, there won't be one for next week. So this is a really busy time of the year for me. I do a lot of lectures. I have my own in-office courses. So there's not a lot of time. But I have a good one for you. I know the style of these podcasts are different because quite honestly, it's really hard to just sit down here and generate material each week that's worth you listening to. I mean, that's the bottom line. And I've done it now. I didn't even realize it for almost 4 years. And, sometimes I come out and it's probably flat. I don't mean to be such. Maybe I'm tired. I go back and I cringe because I hear it in my voice, and I probably wouldn't listen to me. By the way, here's my morning coffee. And sometimes I'm fiery and emotional, and that's usually connected or related to something that happened in my office. And that's what this one's going to be. Fiery, maybe a little emotional. I really never know exactly how they're going to come out until I do them. Before I get to that, which will be quick, I just want to thank everybody, like I always do, for tuning in, downloading. You guys haven't been downloading lately as much. I have a cold, by the way. If you're watching this, you see me with tissues. And I'm okay with it. Now, I get a lot of mail from you lately, and I love that. Compelling stories. I do know why I do these. This is true. This occurred to me this morning as I was getting ready. Have you ever, without any agenda, spoken to somebody? Maybe it's your child, maybe it's a friend, and motivated them, like, you can do this kind of talk. And then later watch them do that. That is really powerful stuff. And I really do get a lot of emails literally from around the world. Listen, I just work really hard. It's all I've ever done. And I do multiple things, probably as much as I can do. I work full time. And when you work full time, you don't have a lot of time to do endless amount of other projects. But I lecture, do hands-on courses in the United States for various ADA and AGD components on models. And of course, I have the courses live on patients, not models, back in my office. And I try to write some articles and blah, blah, blah. My point is you do what you do because it makes you feel happy at the end of the day. And I believe the thing that influences me the most to do this is the motivation and the impact, even on just a few people. And that's why I brought that up. But thank you all. I do want to say, and I know I keep bringing it up because now I feel there's no going back. I'm in negotiations with a meeting planner for the live Lionhearted weekend. I will give you details as I don't even know the date yet, but it's certainly going to be in enough time so you can plan around it. I'm really hoping I get to meet some of the Lionhearted audience from around the world, at least Europe, that may be able to zip over and hang out for a weekend. I'm open to your suggestions. Listen, I've done these before. I did it 20 some years ago. And it was primarily me, breakout lectures or teaching programs of critical stuff that I believe in. Scheduling, the responsibility of different members of the clinical team. Certainly new patient coordinators and screening them, and the language to get paid up front, and verifying appointments. So we don't have a lot of broken appointments in my practice. And it's not a brag thing, it's a fact thing. And we are far from flawless. And knowing my personality that you've gotten to know on this program, you can bet I would share that stuff as well. But I'm not sure whether to add in, which I have no problem with, added speaker for a few hours, or I'll try to figure it out. One thing I do know is when you do something like this, at least for me, it like bears my name, and I will go above and beyond to represent my brand very, very well. There's no way you'll go there and it'll be like, gosh, I expected more, or potato chips. I'm thinking, after day one at the end, a cool hour and a half cocktail party where we all can mingle and stuff like that. Anyway, it's in an early formative stage that I can impact it. And if I didn't say it yet, I am thinking Philadelphia. Okay. The subject of this week, and you might be surprised by this, and the name of this podcast is, what does the military have to do with your dental practice success? That's right. That's what I said. What does the military have to do with a dental practice success? So full disclosure, I really don't like authority. I'm not really, never did. Nobody would associate me or my personality and think, oh, he must have been in the military. I grew up with a very strict father, very staunch Republican, tough guy. And I was never easy horse to tame, and quite frankly, it never happened. And so I'm saying that to you because I have fervent beliefs that you should incorporate the traits adopted by the military to run a successful practice. And I know that overall statement may turn some of you off. And I know I've also alluded to this kind of messaging in the past with you. And when I say, listen, it ranges, but I have at any time about 20 employees. And they've been with me an average of 20 years. I've told you that. Some there are 40, many over 20. And of course, there's newer ones in a range of 5 years to whatever. Nobody calls me anything but Dr. Rasner. Do you think after 42 years, I really give a rat's you-know-what that they have to do that? It is a management thing. It is. And you have to manage. There's no way you can achieve the levels of success that I allude to in these podcasts by not being a manager as well. And I know that flies in the face of many management gurus out there. I have managers. It's at the end of the day. Now, listen, I have 2 practices. If I had 5, 6, or 7, I guess you need a manager. You better have a manager that carefully emulates your style and philosophy. I that's not what this podcast is. This is based on the philosophy of primarily one practice. And it was pretty easy. Listen, it's not a gigantic accomplishment. to be in a practice for 30 years, move up the road 20 minutes to a different town, and establish another practice. I could actually go back and forth, which I thought I was going to do, but I never did. And so, yeah, I have two. And I had astounding success. It's funny, I should tell you about this. So the one in the original town of Bridgeton, New Jersey, we did 4.3 mil one year just with that practice. Flash forward 12, 13 years, and I am in the second practice that's the 20 minutes up the road. The original practice I was in does about a mil. The one I'm in does 4 point something. Boy, that's a coincidence, isn't it? And it's about skill sets and what you hear me preach to you and try to get you to adopt. You're not going to do that. You're not going to do that. And it's more than just skill set. It's really a symphony of very careful protocols about what the clinic does when I'm doing this and they're doing that. It's utilizing everybody to their maximum. It's pretty cool. But I'm getting off track. So what does the military have to do with a successful dental practice? Well, you want to know what works in business? You want to know what works in your dental practice? Let me tell you what doesn't work for starters. And of course, the opposite of what I'm going to say is what you should be focusing on. Here's what doesn't work. Anything goes. Just, you're okay with whatever happens. And I know what that is like. Because I don't have to tell you again in this podcast, what we do is quite hard. We work in that little section of the human body, for most part, called the mouth. And there are certain days where you're working on alligators, right? And if you're right-handed, you're working on number 3, 4, and 5 for crowns, or the lower right side. And this person opens up, you can stick their head inside their mouth. That's a good day, right? Are there other days for you, like me, where it seems like you're a specialist on number 15 or 18, with a hippopotamus-sized tongue? That was this week, by the way. And when that stuff's happening, and you're standing a little bit and leaning over the patient to make sure the prep's correct, and, that's even on sedated patients, this is hard. And your sciatica is like going through the ceiling like mine. I'm having surgery, by the way, on December the 14th. My third back surgery. So, yeah, sometimes on a day like that, somebody comes in late or does something that I just can't believe defies things I've been preaching, and because I'm constantly micromanaging. I don't even know if management people that are in the profession for that reason to help you guys look at my podcast. I know some do. And they're probably freaking out that I'm saying this to you. But I know everything that should be done before it even happens. So what doesn't work is anything goes. What doesn't work is you can come in pretty close to on time. Now, think about that one. And I know you can relate to this. I have some really tremendous employees, but a couple of them, for whatever reason, that are supposed to be there at 8, just think it's fine to come in at 8:20. Now, we don't start patients until 9. I don't care. I've always said, what sports teams show up to play? Right now, we're at the baseball playoffs, right? They show up 5 minutes before. Hey, let's get your gloves and hat on. Get out there. The first pitch is coming up. Why would it ever be different in a sophisticated dental practice that's got multi-layers of things going on? You got to go in and be prepared. The hygiene team's got to review charts. The dental assistant team, they got to have a quality morning meeting. And you're showing, I got to worry, but what else do I have to say to you? Not you. I'm thinking in my head of the talks I've had with certain employees that are in my head right now. So no, it doesn't work if it's okay all the time. That anything goes. Just, we'll get over that. I can't think of anything right now, but it's going to come to mind as I'm doing this with you. One of them is, I come in pretty close to being on time, don't I, Doc? It's not okay to get around to things tomorrow. It's not okay. When I ask for something, unless I ask for it or you, at 4:45, well, even if I ask for it at 4:45, if that business is open that I'm seeking, it's today. And if your attitude is it's always okay till tomorrow or Monday, that's why you don't have a consistent raise of an arc in your productivity, in your bottom line, in your morale, in your happiness, in your practice. That's just the truth. If you're okay with, it's pretty good. See, the military doesn't do that. They have strict protocol to achieve what they have to achieve. It's not okay calling out. Yeah, calling out sick, that's what I said. Now, jump all over me, right? You know what I mean. I've been in business for 42 years. There are people who, I just did an in-office course, my extraction course. One of my instructors was 8 months, 1 week pregnant. She could have easily not been there. And 100% of the universe, including me, would certainly understand. But some people take their obligations, and in this case, I'm talking about coming to work. See, let me just say it the way it is. I've noticed in my 42 years, there are a myriad of times when somebody's out on vacation or they take off a Thursday. And that person, come Monday when they're supposed to be back, mysteriously has an ailment and they call out. I know people get sick. If you're watching this video, I don't feel well right now. And of course, we've just gone through COVID, and that's an outlier and doesn't fit into this conversation. So let's get that straight. And we can't use that the rest of our lives when COVID becomes a flu, the same flus that we've been dealing with up until COVID, our entire lives. I get it. But you just can't use it as an excuse, that or a little bit of a sniffle, to call out, or you're hungover. It's just not what it happens. I mean, I went 29 years, me, and never called out. I'm not kidding. I also, by the way, had an increase in productivity and bottom line profit 29 years in a row. It broke in 2007 or 8 for 2 years. Really not the point. We're talking about what works and doesn't. So not anything goes, not coming in pretty close to being on time, not okay that we'll get around to it. We'll do it on Monday, Doc. And that doesn't mean, by the way, and I need to hear me on this, that because that's my style and I'm imploring some of you to adopt a similar style if you're struggling. Look, if you're Mr. Rogers, there was a thing in the 70s called, in dentistry, or early 80s called Quest, I think. Quest. I could be wrong. And you started every morning with a group hug. If you have consistency in what you're achieving in your little community of your dental practice, everything represented professionally to the patients in that practice of yours, consistent excellence, a happy practice, I'm talking patients, then keep doing it. It's fun. I think for the most part, that doesn't work. You can have a group hug every morning. That's not going to cut it when somebody doesn't know where a case is for a patient that came from out of town at 2:45 that you promised to have that case, and they told you they needed that case on October the whatever, and you're going to let them down because a protocol got broken. Because anything goes in your office. We can make that happen. I know some of you aren't going to like this. I don't really care. Some of what you're hearing happens to me sometimes. And if it happens to me even a little bit, I am not a happy guy. I guess my point is, I'm outside my office or after work, it's gone. I guarantee you, if you go to the Lionhearted live, and I will tell my staff 100% to tell the truth if they ask you. They'll tell you I'm really tough in between the game time. After game time, you'd love to party with me or just hang out. And I know many of you can adopt the same thing. So it's not okay to be calling out because I'd like to have one more day off. It's not okay to have the boss remind you every other month about a change that you already made a few months ago in protocol. So a good example of that is this monthly meeting thing, which one of these podcasts soon, I want to break that down like a surgery and tell you what has to happen in that. That is the most important part of your day. If you don't have a quality morning meeting, which we don't right now, my office does not, and I called a meeting in the middle of patient care for 10 minutes on Wednesday. So I'm with a patient. I'm doing core buildups, of which I have to wait 12 minutes after I do the buildups to prep them. It's a Bill Strupp core buildup technique. And it's very strict. But I wait 10 minutes before I start prepping the tooth, and I knew that was coming up. So I told one of my staff members to assemble the staff in the kitchen. At the time I knew, and I told her in 5 minutes because I knew I'd be finished that procedure. And I talked about breaks in what I'm telling you right now. I said, I don't get it. I don't understand what's happening here. And that you're okay with it. Because there's not a person in this room about what I'm addressing that thinks I'm exaggerating or is hearing it for the first time. Why would you not listen to something that makes us better? And, we have this particular case, by the way, is we have productive time in the office and what I call non-pro. So when you have a busy perio surgical prosthetic office, you better schedule with intent. And so from 9, sometimes 8:30 to 3, it's always pro. It means it's new production coming into the office. But when you have a busy office, there's always things called non-pro. Maybe a crown broke off that you just put in because you missed the occlusion 4 months ago. It's broken to the gum. And you really can't charge to do it, to fix it. Or anything in that realm. Or, by the way, gratuitous work that I do every day. I have a patient that comes to us, and I'm sure you can relate to this, that when she came to me 20 years ago, her mother took care of her care, and she was 20 years old. Well, guess what? 20 years later, she's suffered through cancer. Her mother's passed. Her mouth is destroyed by all the chemo agents that she's had to take. I mean, she's in a wheelchair, and she's a 40-year-old girl. And I'm doing her mouth over for free. I'm not saying that to you to be bragging or something, because I don't feel that way a little bit. I'm saying it to you because that's part of business. It's part of a practice. What happens when an implant fails? When they have a vitamin D deficiency and you have a spinner, the inexplicable spinner at 5 weeks, and you got to take it out, graft it, wait 3 months, 4 months, use Gem 21, whatever where are you going to do this? And I find it most efficient to have 2 hours at the end of the day. Sometimes it's an hour, sometimes I don't have any, and have those patients there. Well, this patient, they put a gratuitous patient, a patient, I play tennis sometimes. And I've met this kid, this young kid that's a fabulous tennis player and has no money. And I've known him now for 3 or 4 years. He's in high school. And he had these awful 2 front teeth. And I veneered him for nothing. But that's a non-pro and goes from 3 on. And he was smack in the middle of my day. That may not seem like a thing to you. Here's why it's a thing. Because when I have a new case, a really invested case, and I need an hour and a half to start it, and I'm told I don't have anything for 5 weeks. You follow me? And that patient I just alluded to is smack in the middle, and nobody sees that. They just see a bunch of names is what happens. And nobody's really, and I know what's happening is that they weren't doing diligence to the morning meetings, because the morning meeting was absolutely the beacon of my success for many years. And I was involved in it. I mean, I would put in motivational things. I would remind our team why we get to be off on Friday, Saturday, Sunday, why we don't have to work evenings, because we are worth it, but we're on stage for every patient. We're a Broadway show that has to perform at peak level. Nobody wants to go to a Broadway show and have it be off and say, they were off one day. And especially in a Lionhearted practice that has trained and embraced competitive high fees because you earned it. You're at a network. People are investing more with you than they ever dreamed of prior to you because they believe in you and trust in you. That's the Lionhearted way. You do comprehensive care approach. Your patients have higher expectations from you, and they are less forgiving when you do drop the ball. You hear me? So that's why all these other things that would never be okay in the military are not okay with me. So when I go to the trouble of having a special meeting, I don't mean the one I just told you about in the middle of the day. That was, to me, that was a foghorn alert. Where are you guys at? We're getting sloppy here. I don't like chaos. I don't like any of the things I just told you, that anything goes. It's okay. No, it's not okay. And I took the time, and you take the time to train people. It's not like you have the right as the boss or the micromanager or manager to get on anybody if you haven't taught them these things. But I have. Really clearly with a lot of time. And by the way, they're getting paid while I'm teaching them. So this is how we do things around here. And then the last thing that kind of bothers me is when you have an office with staff members that blame nasty patients because they're nasty. In my opinion, in 42 years, not everyone, but the overwhelming majority of your patients that are sometimes feel the presence of nasty are because something happened in your office that made them that way. You changed their appointments or appointment times too many times. You got their bill wrong. You did something. When you ever be in your office, guys, and somebody brings you a chart, your manager, and says, I need to talk to you about this patient, Dr. Rasner. She's really difficult. As soon as I hear that, my antenna is up and I want to know the whole story. I don't want to hear one side of it. I want to know, because that happened to me not so long ago. And I had an amazing relationship with this patient. And I was just, and look, as you grow, you're not going to be able to treat every single patient that comes to you. You're going to get associates. And you're not going to be able to do every single procedure as you might be doing right now. So, when you get an associate, you have to have that talk. That it's as if you are doing that direct composite restoration. And the relationship that that associate, and by the way, all your staff, has with that patient has to be reflective as if it was you, or it never works. Unless you don't aspire to this level of excellence. Gosh, I hope this is coming across because it feels like it to me. So I know I'm getting kind of far into the podcast, but I want to say a couple of things. So I came in today with the thought that a lot of you are too loosey-goosey with your leadership. And that's why you're not at the level you want to be. And I am not telling you to be Mussolini and have this power trip thing over your team. I am telling you that it is not okay to not have protocols. That's why I wrote the protocol book. It is not okay. I mean, I remember a time, one of the protocols in my protocol book was going to the store or out of the office one time. I know it's trite and insignificant as that sounds, but I do remember times, because I'm always busy like you. And I would just I remember hearing somebody saying, "Oh, we're going over to Staples," and I said, "Didn't you just go out 2 hours ago? And you were out for like an hour and a half." And I realized, yeah, but I didn't know we needed this or that. That's not order. That's not a system. Look, I don't understand the world I just said right now as well as I used to. The whole thing, the lack of a reliable workforce, the unbelievable difficulty for us to replace people, the acceptance by my colleagues to give pretentious sign-up bonuses to hire a needed staff member. What? What is that? Do we not have any principles? That's what I mean. The military would give you sign-up bonuses, but it's the military. Your life's in danger. You are crumbling to this new wave out there in the workforce that is demanding and unreasonable, in my opinion. And if you're allowing that to creep into your culture, you're going to need some help. Because if you have to pay people bonuses and just do anything you have to do to get them to work for you, because it's post-COVID now. My staff used to tell me, every summer, hygiene would drop to the point that we would actually reduce hygiene days. And I mean, that went on for years. And I just one day woke up and said, you know why that happens? That happens because it's the same thing as the person that says, every August I get a cold. And that person does get a cold every August because it's a self-fulfilling prophecy. And I said, we're not doing that anymore. We're not going to allow this summer where everybody kind of chills because our kids are off. And hey, man, I'm running a business. My business is at 9 months a year. I'm not a school teacher. School teachers will get mad at me right now. Our business is 12 months a year. And what you have to do, so we started beefing up the hygiene, just like you've had it seen since COVID, right? Everybody's hygiene's through the roof because a lot of people missed for anywhere from a year to 3 years. So it always seems there's nowhere to put anybody right now. If you want me to talk about where to put them, I'll tell you about that. Write me a letter. You might need another hygienist. You might have to expand your hours. How bad do you want success? I mean it. I don't know how this came off today, but let me finish. And we fixed the hygiene thing. We started preparing for hygiene in March, in the summer, and I remember several Augusts being my best months of the year. That was strictly a mind thing on my part that I allowed to be moth-eaten schedule for years because, here's what I would hear. hey, doc, everybody's on vacation, and it's summertime, and now anybody wants to come in and, oh, really? Is that what it is? Is that how it is in hospitals too? Really? That's a crock of you know what. I guess what you're hearing from me today, and I'll leave it with this, maybe we'll pick up on it, is I'm not an advocate of anything goes. The military doesn't do that. And the military has been in business for 300 years. Think about what it takes to be in the military. And maybe we should extend this next time. It absolutely is 100% about teamwork. Do you have that in your? Do you really have and foster that culture of teamwork together? Do you even have the right players? How about diversity and inclusion? I've had times in my practice where it was exclusion, where somebody new comes in and other people felt intimidated. And it certainly wasn't, that's not the case a little bit today, because I am wildly aware when I bring somebody new in of what's going on. I make it my business to be, unless I'm in an operatory, obviously I can't be everywhere at any moment, but I do follow-ups constantly in the beginning because it's so costly to bring somebody in and then lose them in 6 months or 3 months when you don't have to. Accountability is the biggest missing quality and virtue on most dental teams in any business, not just dental. System-oriented, this is military talk. System-oriented. They have systems for everything. Do you? That's where the protocols came from. And, dependability, integrity, whether it's doing a great job from the insurance department with the billing to cleaning the cement off a temporary, whether somebody's right there watching you or not. I hope this resonated with some of you. It got to me. Thanks for listening, guys. Look, what do we have left? About 6 weeks of the year. Keep hitting me with the emails. It inspires me to inspire you. Tell me what you want to talk about. Tell me how you feel about... And by the way, if you Google successful business and military traits, which I did after I wrote this, it backs up everything. This is all me talking to you, but it backs up everything I'm saying. Have a great week. I'll see you next week on the Lionhearted.